Hello, student. Hello. Uh, Today, topic of lecture, the blood vessel system, part 2. Next question of lecture. The axillary artery, the brachial artery, the radial and ulnar arteries, the branches of descending aorta, branches of the thoracic aorta, and branches of the abdominal aorta. The axillary artery. The arteria axillary start at the lateral margin of the thorax at the level of the first rib and traverses the axillary cavity between musculus pectoralis major and the tendon of the musculus latissimus dorsi in front and medial of the axillary arteria axillaris is located nerve trunks of the brachial plexus of three sides. On the lower edge of the musculus pectoralis it merges into arteria brachialis. The outlet of the arteria axillaris supplies the area of the shoulder, its muscles and parts of the anterior abdominal wall. Arteria axillaris. Arteria, you see arteria axillaris. Plexus brachialis. Three segments of arteria axillaris are distinguished along its length. The trigonum clavico-pectorale from the clavicle to superior margin of musculus pectoralis minor. The trigonum pectoral posteriorly of musculus pectoralis minor. Next, the trigonum pectoral subpectorale from the inferior margin of the musculus pectoralis minor to the inferior margin of the pectoral major. Segment arteria axillaris. The branches of arteria axillaris in the trigonum clavico-pectorale. First, the superior thoracic artery, the acromiothoracic artery, the branches of arteria axillaris in trigonum pectorale, the lateral thoracic artery, the branches of arteria axillaris in the trigonum subpectorale, the subscapular artery, the posterior circumflex humeral artery, the anterior circumflex humeral artery. The branches of arteria axillaris in trigonum claviculo-pectorale. First artery, the superior, the arteria thoracica superior, arteria thoracica superior, branches out in musculus subclavius, both pectoral muscles, musculus serratus anterior, and the nearest intercostal muscles. Arteria thoracica superior. Second artery, arteria thoracoacromialis. Originates at the superior margin of musculus pectoralis minor and divides into branches, some of which pass upward and laterally to the acromion. There are the anastomose with arteria suprascapularis to form a network of vessels that take part in supply the shoulder joint with blood. Other branches stretch to musculus deltoideus and to both pectoral muscles. What do you see this picture? You see anastomosis between arteria suprascapularis from truncus cervicalis, or truncus cervicalis, arteria suprascapularis, and arteria dorsalis scapularis, this forms anastomosis between arteria subclavia and arteria axillaris. What you see anastomosis between arteria suprascapularis, between rami acromialis, arteria thoracoacromialis. What you see? Two anastomoses. And the next anastomosis between arteria circumflexa humeri posterior and arteria circumflexa humeri anterior form anastomosis. What do you see? Next artery, axillary artery. The branches of arteria axillaris in trigonum pectorale. The lateral thoracic artery. Arteria thoracica lateralis. Descends on the lateral wall of the chest and gives off branches to mammary gland and the surrounding muscles. Arteria thoracica lateralis. What you see? Arteria thoracica lateralis, arteria axillaris, arteria thoracica lateralis. The branches of arteria axillaris in the trigonum subpectorale. The subscapular artery, arteria subscapularis, is largest branch of axillary artery. It separates into two trunks, which passes through the foramen trilaterum to the dorsal surface of the scapula, where it anastomoses with arteria suprascapularis. Next, arteria thoraco-dorsalis. Arteria thoraco-dorsalis, which is a continuation of the subscapula and passes along the lateral border of the scapula. Arteria subscapularis, arteria thoraco-dorsalis. Arteria axillaris, arteria subscapularis, arteria thoraco-dorsalis, arteria axillaris. Arteria thoracica lateralis. Thoracoacromialis, arteria thoracoacromialis. Next picture, next photo, you see arteria axillaris, arteria subscapularis, arteria thoraco-dorsalis, arteria lateralis thoracica lateralis, next artery, the posterior circumflex humeral artery, circumflexa humeri, arteria circumflexa humeri posterior, passes to back into the foramen quadrilaterum and went posteriorly around surgical neck of the humerus. It's covered by deltoid muscle, to which it gives off branch. Next, arteria circumflexa anterior, curves around the brachial bone, anastomosing with arteria circumflexa humeri posterior. Arteria circumflexa anterior gives off branches to the muscles and the brachial joint. What you see? Arteria circumflexa humeri anterior and arteria circumflexa humeri posterior. all the branches of the axillary artery anastomose widely with branches of the subclavian artery. Next artery, the brachial artery. What do you see? Brachial artery. The arteria brachialis is continuous with the axillary artery, beginning at the lower body of musculus teres minor. It leads to sulcus bicipitalis medialis, where at the level of the neck of the radius it divides into the terminal branches. Sorry. The radial and divides into its terminal branches. The radial, arteria radialis, and arteria ulnaris. Brachial artery gives rise to the following branches: arteria profunda brachii, arteria collateralis ulnaris superior, and arteria collateralis ulnaris inferior. This is three following branches: arteria profunda brachii, arteria collateralis ulnaris superior, and arteria collateralis ulnaris inferior. Arteria profunda brachii gives off an artery that supplies the brachial bone with nutrients. The deep brachial artery gives off posterior descendens branch collateralis media, arteria collateralis media, which penetrates the thickness of musculus triceps and anastomoses with interosseous recurrent. And with anastomosis with arteria collateralis radialis. Anastomosis between arteria collateralis, arteria profunda brachii, arteria collateralis media, and arteria collateralis radialis. Anastomosis. Arteria collateralis radialis anastomosing with arteria recurrens radialis. Next artery, arteria collateralis ulnaris superior, rises from the brachial artery in the middle of the arm and settles into sulcus behind the epicondylus medialis, where it anastomosis with arteria recurrent ulnaris posterior. Posterior. Next, arteria collateralis ulnaris inferior, rise from the medial semicircle of brachial artery about 5 cm above the end of the latter, obliquely passing over the surface of musculus brachialis in medial and distal direction. This artery anastomoses anteriorly of the epicondylus medialis with artery recurrens ulnaris anterior. It is rami artery recurrens ulnaris, rami anterior and rami posterior. This rami form anastomosis with arteria collateralis ulnaris inferior and arteria collateralis ulnaris superior. This is form anastomosis. You see arteria radialis, arteria ulnaris. This is, you see, arteria recurrent ulnaris, and you see next artery, arteria collateralis ulnaris inferior. This is, you see, brachial nerve brachialis, and under the nerve brachialis located arteria brachialis. This is arteria collateralis ulnaris inferior. Next artery, the arteria radialis. Arteria radialis is directly continuous with the brachial. Arteria brachialis. It passes medially of musculus brachyradialis. Passes medially of the musculus brachyradialis. What you see, musculus brachyradialis. At first under its cover and then in sulcus radialis. In the 1/3 of the antebrachium, where the muscles become tendons, radial artery is covered only by fascia and skin. What you see, arteria radialis. Arteria radialis. Arteria radialis passes to the back of the hand, curving around the lateral edge of the corpus. It exits into the palm through the first interosseous space between the bases of the first and second metacarpal bones. On the palm arteria radialis together with deep branches of the ulna, arteria ulnaris, forms the arcus palmaris profundus. It is the deep palmar arch. The deep palmar arch forms arteria radialis and the branches of arteria ulnaris. Located arcus palmaris profundus located on the palm. Deep palmar arch. Arteria radialis form gives off next branches. Arteria recurrens radialis. It is the only branch of the proximal forearm, runs on the radial side beneath the musculus brachioradialis. To the reta articulare cubiti. Reta articulare cubiti. And supplies the surrounding muscle. This is arteria recurrens radialis. Reta articularis cubiti. Supplies the surrounding muscle. Next branches rami carpalis palmaris. Rami carpalis palmaris. What you see? Rami carpalis palmaris. It runs into the carpal channel and supply it. Next, rami palmaris superficialis. Together with arteria ulnaris, it forms a superficial palmar arterial arch under the palmar aponeurosis. Next, rami carpalis palmaris dorsalis. Rami carpalis palmaris dorsalis. These branches essentially dorsal in the area of the retinaculum musculorum extensorum, originating from the rete carpale dorsale. The arterias metacarpalis dorsalis, which each divide into two. Arteria digitalis dorsalis, arteria digitalis dorsalis. To supply the posterior side of the finger. This is, you see, palma. This is behind palma, located dorsal surface. The next rami, arteria principes pollicis. What you see, arteria princeps pollicis. It originates as the arteria radialis, passes through the musculus interosus dorsalis first and supply the palmar surface of the thumb. Arteria radialis indices. Arteria radialis indices. It runs along the radial side of the index finger. Arcus palmaris profundus. Below musculus adducta pollicis, it overlies the basis of the 2 and 4th metacarpal bones and connected to the rami palmaris profundus of the arteria ulnaris. The arcus palmaris profundus gives off next artery, arteria metacarpal palmaris, arteria radialis, this is arteria metacarpalis palmaris, these 3 artery. This artery to supply musculus interosus, which connect distally with the digital arteries. Digital arteries. This is 3. Arcus palmaris profundus. Next, artery ulnaris. Artery ulnaris. After exiting from the arteria brachialis, the arteria ulnaris runs under the musculus pronator teres to the ulnar side of the forearm. Here it attaches to nerve ulnaris, and runs along the musculus flexor carpi ulnaris to the hand. There run between os pisiforme and humulus, osis hamad into the Guyon's canal and then turn off into palm to form the superficial palmar arch, arcus palmaris superficial. Arcus palmaris superficial forms arteria ulnaris and rami palmaris superficialis, branches of arteria radialis. This is arcus palmaris superficialis. Arteria ulnaris has 5 branches. Arteria recurrens ulnaris. It runs proximally under the musculus pronator teres to the nerve ulnaris and reta articulatia cubiti. Next arteria interossea communis. As the most powerful branch of the arteria ulnaris, it medially runs a short section distally on the musculus flexor digitorum profundus until it divides into following branches: arteria interossea anterior and arteria comitans nervi median. 2 branches. Arteria interossea anterior, it runs on the membrane interossea antebrachi and penetrates far distally to discharge into the carpal rete carpale dorsale. Arteria comitans nervi mediani, accompanies the nerve medianus. In next, arteria interossea posterior. Arteria interossea posterior runs on the dorsal side on the membrane interossea together with rami profundus nervi radialis to the reticarpalis dorsale and the musculus ancaneus arteria interossea dorsale. Interossea dorsale. And the musculus ancaneus, arteria interossea recurrens, arteria interossea recurrens, arteria interossea recurrens reaches the rete articulare cubiti. Rete articulare cubiti is formed next artery, arteria interossea recurrent, arteria recurrent radialis, arteria recurrent ulnaris, and branches of arteria collateralis ulnaris inferior and arteria collateralis media, and arteria radialis, branches of arteria radialis. Next branches, rami carpalis dorsalis, rami carpalis dorsalis. It runs to the dorsal side of the wrist and discharges into the reticarpale dorsale. Rami palmaris profundus, branches of in the Guyon's canal and penetrates the hypotenuse muscles to run to the arcus palmaris profundus. Arcus palmaris superficialis lies under the palma aponeurosis of the tendons of the long finger flexor. It fed mainly from the arteria ulnaris and anastomosis with rami palmaris superficialis of arteria palmaris, arteria radialis, originating from the superficial palmar arch, are the digital arteria digitalis palmaris communis, which branch into two arteria digitalis palmaris propria along the finger edge. This is, you see, arcus palmaris superficialis, which forms arteria ulnaris and branches of arteria radialis, rami palmaris superficialis, arcus palmaris superficialis. You see, this is arcus palmaris superficialis. Palmaris superficialis. This is, it is arteria ulnaris. This is branches of arteria radialis. Next, branches of the descending aorta. You see, descending aorta. The branches of descending aorta can be classified of the parietal branches stretching to the wall of the cavities and the visceral branches running to the contents of the cavities, the viscera. The descending aorta is divided into thoracic aorta and abdominal aorta, body diaphragm. Branches of thoracic aorta. The thoracic segment of the aorta gives of the following branches: rami visceralis and rami parietalis. Rami parietalis, the first, the second phrenic arteries, arteria phrenica superior, the small branches of the thoracic aorta, which branch out on the superior surface of the diaphragm, where they anastomosis with pericardiophrenic, musculophrenic, and posterior intercostal arteries. Next branches of thoracic aorta. This is posterior intercostal arteries. This is vertebra. Arteries. This is aorta. This is branches. Это posterior intercostal arteries. Arteria intercostalis posterior. Branch off from aorta. The 12th posterior intercostal artery passes below the rib. This is subcostal artery, arteria subcostalis. Posterior supply of the intercostal space. What you see, branches of the arteria intercostalis posterior. Это dorsal branch, spinal branch, cutaneous branches, and collateral branches, and lateral mammary branch. Intercostal artery supplies intercostal muscles, ribs, abdominal muscles, skin, and other. What see picture? What you see pars thoracica aorta, thoracica, and you see intercostal arteria intercostalis posterior. This is, you see, branches, rami dorsalis, rami cutaneus lateralis, rami cutaneus medialis, rami spinalis, rami collateralis, what you see, and rami cutaneus, rami mammarius lateralis, and anteriorly you see arteria thoracica interna. Arteria thoracica interna gives of branches rami intercostalis anterior, rami costalis anterior, and arteria intercostalis posterior forms anastomosis. This is connect to form anastomosis between aorta and thoracica, arteria thoracica interna. Arteria thoracica interna branches of arteria subclavia. Now do you see picture? Ribs, the intercostal space. What do you see? Triada. This is vena intercostalis posterior, arteria intercostalis posterior, and intercostal nerve. This is triada. Artery, vein, artery, nerve. Intercostalis, vena intercostalis posterior, arteria intercostalis posterior, and nerve. Rami visceralis of the thoracic aorta. This is, you see, rami bronchialis. Rami bronchialis supplies the lung, the bronchi. Next, rami esophagus. Rami esophagus supplies the wall of the esophagus. Next, rami pericardiaca. Rami pericardiaca gives of interposterior wall pericardium. And next, rami mediastinalis. Mediastinalis pass to lymph nodes and connective tissue of the posterior mediastinum. Do you see this is structure? Note this is artery pericardiophrenic. Note nerve. What you see, arteria intercostal posterior. Intercostal posterior. Next, branches of the abdominal aorta. Aorta. The parietal branches of the abdominal aorta are part, except for the medium sacral artery, which is actually the caudal segment of the aorta whose development is retarded. The visceral branches of the abdominal aorta are classified as part or unpart. This is branches of aorta: parietal, visceral. Visceral are classified and part or unpart, part or unpart. What you see, abdominal aorta. This is unpart branches. What you see, truncus celiacus. Next, arteria mesenterica superior and arteria mesenterica inferior. This is abdominal part of the aorta. The unpart visceral branches, it is the truncus celiacus, arteria mesenterica superior, arteria mesenterica inferior, and the part visceral branches. This is arteria suprarenalis media, arteria renalis, arteria testicularis, and arteria ovarica. The unpart visceral branches. First, arteria truncus celiacus. What you see, truncus celiacus. This is abdominal aorta. This is truncus celiacus. Is short, 2 centimeter, thick artery rising at the level of the 12th thoracic vertebra in the hiatus aorticus of the diaphragm. It passes forward above the superior border of the pancreas, where it divides into 3 branches. The left gastric, arteria gastrica sinistra, and arteria hepatica communis, and arteria lienalis. This is truncus celiacus. 3 branches: arteria gastrica sinistra, arteria hepatica communis, arteria linealis. Arteria gastrica sinistra extends to the lesser curvature of the stomach and gives off branches to the stomach. And the abdominal part, this is esophagus. What you see photo, truncus celiacus, arteria hepatis communis, arteria lienalis, and arteria gastrica sinistra. Arteria gastrica sinistra, curvature, lesser curvature of stomach. Next branches, arteria hepatica communis passes along superior margin of the head of the pancreas to the superior border of the duodenum. It passing to the right side towards the liver and dividing into gastroduodenal, arteria gastroduodenalis, and arteria hepatica propria, Arteria hepatica propria reaches the porta hepatis, where it divides into right and left branches, ramus dexter and ramus sinister. The right branch gives rise to the artery to the gallbladder, arteria cystica. The proper hepatis artery gives off the branch to a lesser curvature of the stomach. Arteria gastrica dextra, which stretches from right to left to meet a gastrica sinistra. Arteria gastrica sinistra connect with arteria gastrica dextra. Arteria gastrica dextra and gastrica dextra from arteria hepatica propria. And arteria hepatica propria. What you see, truncus celiacus, arteria lienalis, или arteria splenica. This is arteria hepatica propria. propria. Вот она propria. This is arteria gastrica dextra. Arteria gastrica dextra. This is вот она arteria hepatica propria. This is, you see, arteria gastrica sinistra. This is truncus celiacus. Next artery, arteria gastroduodenalis. What you see, gastroduodenalis, arteria gastroduodenalis passes behind the duodenum and divides into two branches. The gastroepiploica dextra, which passes from right to left on the stomach and gives off branches to the stomach and omentum, and the arteria and next artery, arteria pancreatoduodenalis, superior, which branches out in the head of the pancreas and the descending part of the duodenum. Do you see truncus celiaca, arteria gastrica sinistra, arteria splenica, and arteria hepatica communis, arteria hepatica propria, and what you see, arteria pancreatoduodenalis superior, gastroduodenalis, the superior anterior, superior posterior. And then gives off divided branches, rami posterior and rami anterior. This is branches of arteria rami pancreatoduodenalis inferior, superior, inferior. This arteria linealis, what do you say, arteria linealis, passes on the superior border of the pancreas to the spleen. At the spleen, it divides into 5 to 8 terminal branches, which enter the hilus leonis splenica. This artery splenica gives off the arteria gastroepiploica sinistra, which passes from left to right on the greta curvature of the stomach and anastomosis with arteria gastroepiploica dextra, gastroepiploica sinistra, gastroepiploica dextra, form an arterial arch like the arch on the lesser curvature between arteria gastrica sinistra and arteria gastrica dextra, anastomosis which lie in lesser curvature of the stomach. This is anastomosis between arteria gastroepiploica dextra and gastroepiploica sinistra, form anastomosis. Next, the unpacked visceral branches. Superior Mesenteric artery, arteria mesenterica superior, arises from the anterior surface of the aorta, directly below the artery celiacus, truncus celiacus. It enters the mesentery of the small intestine and descends to the right iliac fossa. The superior mesentery, the artery mesenterica superior gives off next branches. Next branches, artery jejunum jejunales. What you see, arteria jejunales. These branches causing in the mesentery to the supply the jejunum. Next, arteria ilialis, branches causing in the mesentery to supply the ileum. Next, artery ileocolica. It passes in the root of mesentery downward and the right towards the ileocecal junction. Next, artery appendicularis. It extends from behind the ileum to the free margin of the mesoappendix. Next, colica dextra. It passes retroperitoneally to the ascending colon. Next, colica media. Colica dextra, colica media. It passes in the mesocolon to the transversa. It is branches of artery mesenteric superior, artery jejunales, ilialis, ileocolica, colica dextra, colica media, and arteria appendicularis, arteria celiacus anterior. Now you see arteria mesenterica superior. It is branches of arteria mesenterica superior. This is what artery colica media, jejunales, ileum. Next artery, arteria mesenterica inferior. Branches, this artery branches of the level of the inferior edge of the third lumbar vertebra and passes downward and slightly to left, lying behind the peritoneum on the left psoas major muscle, musculus psoas major. branches of the inferior mesenteric artery. Next, arteria colica sinistra. Arteria colica sinistra passes retroperitoneally to descending colon. Next, arteria sigmoidea. Arteria sigmoidea. They pass obliquely downward to the sigmoid colon. Colon sigmoideum. In the next artery, arteria rectalis superior. Arteria rectalis superior passes behind the rectum into the lesser pelvis and divides into right and left branches, which after penetrating the musculatura supply mainly the mucosa up to the anal valves. Anal valves. Now this you see, this is artery mesenterica superior. You see jejunum, arteria ilialis, arteria ilialis. What you see, arteria mesenterica inferior. This is arteria sigmoideum. Arteria sigmoideum. This is arteria rectalis superior. Rectalis superior. This is next part, the part visceral branches. The part visceral includes this middle arteria suprarenales media, arteria suprarenales media, originated directly from the aorta and supplies the suprarenal gland. Next artery, arteria renalis, arises from the aorta in front of lumbar 1, divides into several branches which enter the kidney. Next, this renal artery, what do you see? Arteria renalis. Arteria renalis. Next, arteria testicularis and arteria ovarica. Arteria testicularis is a long, slender vessels rising from aorta directly below the origin of the renal artery. The arteries supply testes. The testicular arteries gives off branches rami uterice, epididymalis, and rami tubari. The ovarian artery, the corresponding artery in females, does not enter the inguinal canal but passes into the true pelvis and then to the ovary as a component of the suspensory ligament. This is, you see, only artery testicularis, arteria testicularis. This is part. Branches. Lecture is finished. Thank you for attention. Goodbye, student.